Hi, Chris Ohl, infectious diseases doctor with Wake Forest Baptist Health and advisor for Wake Forest University. So I have a message for Wake Forest students and parents, and it's a two-part message. The first part is that overall this semester we've really done great. The students have been stakeholders in their education and for the success to get through this semester in the throes of COVID. And I really couldn't be happier with how we've done overall. A bit of a bump 3 weeks ago, which when the students saw, when we moved up to Code Orange, everyone came to and did what they were supposed to do. I wish I could tell you that we're going back to yellow right before Thanksgiving break here, but we're still having some cases associated with small social gatherings. So we believe it's safest to stay at Code Orange right now, and particularly to have people limit their social interactions. The second part of my message is it's Thursday, the 12th of November, exactly 14 days before Thanksgiving. And the incubation period for the virus that causes COVID is 14 days. So now's the time to start the ticker. We really need to start doing things that reduce our risk of getting infected with COVID so that you don't have to worry about having COVID when you go home for Thanksgiving or when you are traveling. And so, just a few tips and pointers. During this next 2 weeks, I'm not going to say let's self quarantine. I'm going to say let's chill. This is not the time to be going to bars or clubs. This is not the time to be going to social gatherings, particularly social gatherings that have eating and drinking associated with it. It's time to study, go to class, lay low with small groups of friends, masked and personally distant. And if you do this between now and the time you travel for Thanksgiving, there's a lot less chance that you're going to bring a virus home for persons. You could elect to be tested before going home. We have some students who have decided to sign up for our testing for next week here on campus. And the numbers now are such that we really can't accept any more patients for that program, but you can get tested at other places. And there are several places in Forsyth County if you'd like to get tested before you go. When you get home, you should also lay low for a while. And that means avoiding social gatherings. And if you're in your own household for Thanksgiving dinner, except for the dinner proper, when you should be distanced, you want to wear a mask. And particularly if you have elderly persons in the home, or people who have underlying health conditions, you're going to want to make sure that you're safe around them. Also, hand hygiene, wash your hands or hand sanitize before doing something and then again after doing something, particularly during travel. While traveling on an airplane isn't really all that risky by itself, the airport environment can be. So if you're waiting for your plane and you're in a large gate area or in a small gate area with a large number of people and you're thinking you need to eat and you bring down the mask, you may want to avoid doing it at that point, and eat when you get to your destination or eat before you get to the airport. Because when the mask comes down and around eating or drinking is when transmission can happen. So, in summary, Thanksgiving should be a time of celebration, but it should be done with small groups of people in intimate settings. Large household gatherings are ill advised, large groups of people coming together. And I've been talking about bubbles. You have your bubble of safety with COVID around you. Anytime another person that's not in your immediate household comes in contact with you closer than 6 feet for more than 15 minutes, you've had a bubble fusion event. So I think it's something to be aware of for parents and students for the next 14 days and for the time when you're with your family at home. We really want our deeks to stay safe. We really want them to stay healthy. And we're looking forward to seeing you back next spring.